For this video tutorial, we're going to be looking at the distal biceps insertion at the biceps tubercle of the radius. This can be a surprisingly difficult structure to scan, so we're just going to go through a nice little step-by-step method of actually finding this structure. So with the patient's elbow out in front, I'm going to clasp my hand so the web of my hand goes around the lateral aspect of the elbow. My thumb is going across the elbow joint line. The probe is actually going to go on the ulnar side of the wrist, and I angle the probe back towards the radius. And from here, you can see the artery, okay, and the biceps tendon is actually being visualized through the artery. So the artery is sitting over the top, and then we're using the artery as an acoustic window to see the biceps tendon, which comes down to its insertion here on the biceps tubercle of the radius. So this step-by-step approach, note the position of the ultrasound probe. I'm dissecting off probably around a third of the way down the forearm. My probe is on the ulnar side, and it's angled back looking towards the radius. And this is a way of visualizing the biceps tendon insertion using the artery as an acoustic window.